Yeah, hi, my name's Laurie Hiemstra. I'm an orthopedic surgeon in Banff, which is in Canada. I do mostly sport medicine, knee surgery. Like most orthopedic surgeons, I played a lot of sports when I was younger, and I really was interested in movement and bodies and sport. So I actually wanted to be an orthopedic surgeon my whole life. Back when I was a resident, surgical training was very different. I think back then there was not as much push to get patients through, not as much worry about wait lists. And so surgical residents had a lot more time in the operating room to slowly learn. We had lots of time with our preceptors, and we could really have lots of repeats on the surgery procedures we were trying to learn, which let us do it slowly over time, which is very safe. Today, there's a lot more time pressure. Wait lists are so long, especially in places like United States where they're worried about money and how quickly they can get patients through because it's a for-profit venture. I think you're pushed through and you don't get as much time to actually learn with hands-on. So I think it's a lot more difficult nowadays for surgery residents to get the training they need. I think PrecisionOS, the vision is amazing. So to try to take technology, which is actually, it's really fun. So you take something that we love to play with and to use it to further surgical education is just so important. It's combining, things we like to do with things we need to do and creating something that's really special, helping our surgical residents or colleagues and helping education for surgery in a really safe, effective manner. When we talk about surgical VR training, there are several very important advantages. One is that you can talk to people and train with people that aren't in the same room as you. So again, travel's become very expensive. Our time is so valuable. For me or anyone else to fly somewhere to go train with someone is really costly venture, both for time and money. So VR lets us train and talk to people and communicate even in our own living rooms. So this gives us a huge advantage, especially for training in underdeveloped countries where people really don't have the opportunity to travel. The second main advantage I see is it allows our surgical trainees to make mistakes. Again, if you're learning to operate on a real person, you don't want to make any mistakes. Whereas in VR, you can actually have that freedom to make mistakes and you're not going to hurt anybody. So again, we learn better by our failures than our successes, and VR really lets us explore that. Including the VR curriculum into surgical training is vital. Training for residents has gotten more and more structured. Again, in Canada with the CanMEDS protocol, making sure our residents are well-rounded to allow residents to incorporate VR into their surgical training really allows them to go that extra level so that their training is more robust and more complete with more chances to actually do the techniques and the hand-eye coordination training that they need. So if I was sitting down with a first-year resident talking to them about VR, I would tell them to get on it as much as they can and as soon as they can. Learning how to operate is about learning anatomy, and it's about repetition. So it's just like when you're playing a sport, you're not going to be a good golfer unless you golf and practice and practice. And surgery is the same. So VR allows that freedom to practice over and over and over and over again and get those hand-eye coordination skills and not do that on a real person. I think the most rewarding aspect of being an orthopedic surgeon is the smile on people's faces when you tell them you can help them. And then the look on their faces after you've operated on them and they're getting back to their activities. I do sport medicine orthopedics, so they're active young patients that want to get back to sport and just being active, and to see them go from being disabled to being active is really gratifying. If I could talk to residents nowadays and give them some advice I've learned over the years, I think I would tell them to expand their horizons. I think when you're a resident, you're so focused on, I need to learn how to nail a tibia. I need to learn how to do an ACL. And there is a whole world of orthopedics around there, looking at research, looking at leadership, looking at innovative technology, is more in orthopedics than just operating. And I think it would encourage them to explore their leadership skills, explore their research skills, explore their business and tech savvy skills, just to see what might interest them more than just purely operating our own. The last thing I'd like to share is that I think it's really important that we keep our vision open to new technology, open to new ways of doing things. medicine tends to be very rooted in culture and history. And I think being open to change and making things better, it is really important.